Beyond the Benchmarks, where we go beyond the data to talk about leadership, innovation, and what it really takes to move healthcare forward. I'm your host, Stephanie Dorwart, CEO of Altius Healthcare Consulting Group. Today, we're asking a question every hospital is wrestling with. How do we deliver exceptional care when staffing is tight, budgets are shrinking, and most technology is too expensive? And if you're a rural or community hospital, you feel this pressure most. That's why today's conversation about practical automation is real. It's important. Join me today in welcoming Ted Dinsmore, the president of SphereGen. Ted has built many different companies, advised startups, and worked with 15 to 500 bed hospitals in many different arenas to bring AI to them at an affordable cost. Ted, I'm so glad you're here. You've worked across continents and now you're helping hospitals really automate problems. Can you take a minute and share a little bit more about your background with the audience and some of the highlights of your career?
Sure. I mean, what I've been doing and what we've been doing for the past many years is focusing around the technology in healthcare. So many times we see examples where we're working with customers, and as we're learning from customers what they need, we're actually creating solutions in the technology to help them, and then that has translated across many different systems across the world. So. It's been amazing learning. I say we always learn more about healthcare processes when working with our customers in the services side and implementing what tools work for them.
Yeah, I can definitely agree with that. I know at Altius, many of our best innovations have evolved from conversations that we've had with clients and really solving the needs that our clients share with us every day.
Absolutely.
And with that in mind, I am quite sure that was the evolution of how SphereGen got started. So, can you talk about the, beginning of SphereGen? What led to the development of the company and got you to where you are today?
Sure. We focused on in the early days of Surgeon was services around some of our customers in the Swiss healthcare market, and it was amazing because we built a full EMR with Swiss doctors. And again, as I said, it's sitting with doctors, understanding what they want, what they need. In the case of Switzerland, it's very difficult with the multilingual, right? Because you have German, English, French, and Italian at the same time. So we designed the whole EMR, everything we built, every component was on the multilingual platform. That evolution of starting out with a very complex problem like that has helped us in our learning as a services company to expand to everything else we've done in the United States and other countries.
Yeah, you mentioned the complexity of the Swiss healthcare market, and I think that's remarkable, and it definitely lends itself to, I think, the background that you've had and your ability to take what you learned from that experience and really apply it to the current American market and make things work better. In today's environment, Ted, there's so much consolidation. We're seeing it every day. There's a lot of mergers, there's a lot of acquisitions, large
Absolutely.
hospital systems that are absorbing multiple levels in healthcare delivery. How is that consolidation really changing your world, changing tech innovation, changing AI?
The consolidation accelerates the integration issues and needs. When you look at new hospital systems or how hospital systems are consolidating, it actually, and the EHRs have done a great job in this. I think there's been a ton of great work that the EHRs have done in this, but we still have a ton of more work to do in integration. Whether it's integrating between senior nursing facilities and long-term care facilities back to hospitals, integrating to payer portals, that all that stuff is still outside what the EHRs are doing. And what we're seeing is the integration and has accelerated more needs. Now we say, okay, we have this solved. Now we need to go to the next step. So it's been a big advantage to the system overall because people can move from hospital to hospital and directly do patient care across the system. But it definitely has accelerated the need for more integration.
Yeah, it's really interesting because, both of our companies work a lot with smaller facilities and rural facilities, critical access hospitals. And often, with our clients, we find that they're getting left behind in some of the conversations regarding IT, regarding AI, and even the ability to afford some of the, EHR platforms. In your view, why has this occurred and why is it continuing to happen?
Oh, it's the cost of AI. I mean, you look at how the stock market is going, so embracing AI, and it's great, all the abilities of AI, but there's a cost to it. There's a dollar value cost that rural healthcare and home care and hospice sites just struggle with. They're cost constrained already, and all now to add that on top of it. So really, it's the price tag with AI.
Yeah, you've talked a lot about the price tag, and in our conversations have mentioned that a lot. I know that one example sticks out in my mind that you've shared about Puerto Rico, and I believe that the example was that the tech literally cost more than the entire staff that they had. Can you
Yeah,
elaborate on that a little bit?
yeah,
That's just
yeah.
mind blowing to me to consider that.
Well, and it was really challenging for us to get our heads around it. Like, typically your AI projects are around 75, well, a tool costs around 75 to 100K per year for the AI tools you need on an enterprise scale. So how do we get that? And I'll give the Puerto Rican example, when the person's being paid $15 an hour to do that same work. Or it's offshore to an Indian firm or something like that at $9 or $10 an hour. How do you make AI cost effective for that? And we really worked very hard because when you look at the payback is going to be years to get the payback to the hospital. It doesn't make sense. So what we did was we fundamentally, in those cases, and not every case, a lot of cases we go with the enterprise tools because it makes sense. But in those cases, we took some open source to open AI tools and some tools from Microsoft, and we cobbled together to do the same thing. Now, there's more effort on the services side when we do that because we're taking and building the bench basically. But by doing that, we eliminate the ongoing cost of the hospital. So the hospital is only paying for that upfront initial cost, and the ROI is there then. That's a trick on the services side that you know on the tool side they want to sell AI tools. On the services side, we want to solve the problem and make the ROI for the customer. In the case of Puerto Rico, after the first year, they were able to start saving money. So it makes a lot. You have to make the AI cost model work for you.
Thinking through that, it completely flips the script for hospitals on how they evaluate the solutions and think through things because the subscription model, many times they can't see the return on investment because so it becomes a conversation staller where they don't even consider the software. Can you
Yeah.
expand a little bit more about really how the subscription based model is broken and it's led to the market we're in right now?
Yeah, and totally agree with you, Stephanie. I think one of the examples we had a hospital that had about four automations they wanted to leverage AI on, which cost on the about 100K or so, right? So what we did was we said, okay, let's just spread that out on quarterly payments so we can do it over the year. But again, we're most of the times you're seeing that the AI is embedded in these tools, right? And then they're expanding the cost. Oh, if you want that module, that AI module, which helps you, here's a per patient cost or per claim cost, whatever you want to call it.
Yeah, we talk a lot with our clients about the return on investment and the need to make sure you're balancing the return on investment with your software solutions, with your people, with your staffing in general. And we often relate, the personnel and the fact that you can rely on the people to actually do the jobs and the things that people do best
Yep.
and rely on the technology to do what technology does best, which is automate tasks that humans, quite honestly, don't enjoy doing. And so, solutions like those that you're providing really can help to provide the employees with a better work life balance and to enjoy their job more. But you have to be able to understand that ROI and deliver that in the first place. There was an example you share with me that really resonated, and we were talking. It may be the same one that you were just speaking to, but 15-bed hospital, which is the size of a lot of acute care, hospitals and critical access hospitals, and many are struggling right now. I think 40%
Yeah,
of rural hospitals are projected to potentially close if they don't
that's right.
change. And this example, Ted, they saved roughly $1 million. So even if the software would have cost 100,000 in the example you just shared, that's a 10 to 1 return. But can you talk about that particular hospital, what
Okay.
changed, how it embraced, and the difference you made to the community?
And this is a different example. This is Klickitat Valley Health in Washington State, not the Puerto Rico example. And these are just, I just want to say, these are amazing people that care deeply about their community. But it's a very small team. You only have 4 or 5 people in the back office. It's a 15-bed hospital. And they really spent all their time processing the claims and fighting denials. So what we did was actually free them up from the mundane tasks, like you said, of eligibility check, prior authorization, and focused on getting the right patient information, making sure that patient has the right card, the right, and making the phone call to payers to clear the claims and denials. So it's what mundane tasks that bots can do really well versus freeing people up so people can do what bots can't do, which is talk to that patient and get the right card, get on the phone with the insurance company and say, hey, this claim should be paid. People have to do that interaction. It's about the relationships of the back office and the office with the patients and the payers.
Now, I know that you've built a lot of bots throughout the years, and I am sure the bots that you build continue to evolve and change. You just mentioned, I think, the medical eligibility checks and claims processing. What are some of the other bots that you're working on right now, and what's really the most transformative, transformational, impactful bot that a hospital leader could put in place currently? Let's say I'm a CFO of a
Mhm.
20-bed hospital. I'm looking at balancing my budget. I'm losing some money. I need to make a change. What should I do? What's the most impactful thing right now?
I know it sounds ridiculously simple, but we've done prior authorization so many times, and I'm still amazed when I'm sitting down with a hospital and saying, "What are your problems with your claims, with your denials?" And prior auth is one of the biggest ones. It's almost always one of the eligibility and prior auth are at the top of the list. And one thing really struck me as amazing was I was at an HFMA event. You and I have met at these events before. And I go to many HFMA events, which is where that CFO of the hospital is at. And that they had a doctor at one event speaking to the audience saying, how many people in the audience went to medical school? X number of people raised their hand for nursing, doctor, whatever. And how many people went to medical school and learned about medicine to do prior authorization? It really, really resounds that we have amazing people in healthcare. Yeah, zero. Nobody wanted to do it. We have amazing people in the healthcare system to help with patients, but we have them doing prior authorization. It's nuts. It's just we have to free our healthcare medical people up to do work with patients and free them up from these things like prior authorization.
Absolutely. We talk a lot about going beyond the benchmarks, especially with our clients when we're talking about productivity and the fact, data's benchmarks, it's just numbers. You're looking at the median, better and best. It's feedback. It's showing you where you're performing. But when you see the red and you're seeing you're operating below the median, you get emotional about it when the reality is they are probably spending an inordinate amount of time on things like prior authorizations if, their benchmarks are performing, poorly. And I think it's things like you just mentioned of being able to free up their time on some of those tasks, not sitting on the phone for 4 hours waiting for someone to pick up, not making phone calls and over and over again, and allowing you to put those bots in place for the prior authorizations. So when you're working with your clients and you're talking to them about return on investment, you're talking about some of those pieces. How do you go beyond the dollars and really talk about the return on investment that it might have for the staff, for staff retention, satisfaction, throughput, even accuracy of the claims?
Absolutely. And I'll go back to the Klickitat example. Lori's the CFO of Klickitat. And when we first met, she said, I'm a pen and paper girl. I want nothing to do with bots, Ted. And I'm like, okay, Lori, let's work through this. And she was great. We worked through it. She got a lot of pushback from her staff initially of a bot's going to take my job. It's going to do it. Now, if a bot goes down, we get 14 different emails and phone calls from that same staff saying, hey, the bot didn't do it, because now they are freed up and they're doing the calls, they're working with the patients. When the bot's not available for some reason, not our fault, that they really deeply rely upon these bots to do that job. And it's really important to them, freeing them up. And the satisfaction is there because they're not dealing with the mundane, okay, I got to get through this list of claims today task. They're actually focusing on the ones they need to focus on.
You mentioned the client example where the CFO said, I don't want anything to do with bots. I want nothing to do with automation. I love paper. I love pencil. I love the way we've always done it. Hospitals and healthcare in general, we've been an industry that's very resistant to change. And, we resist doing anything different. What have you really learned, with your clients with this process, about the change management process, and how do you help them overcome the skepticism of AI and the skepticism of doing things differently?
I think the simple answer, and this isn't something people talk about often, but I really fundamentally feel that, and we do, as every hospital is unique. And I mean that with all sincerity, honestly. So many people say healthcare is the same as spread across the country or world. We disagree entirely on that, because really we have passionate people in these roles, but they're unique situations with everyone, right? I often talk to groups of healthcare professionals about the concept of AI. And what I phrase it is, okay, if you had a virtual assistant, what would that virtual assistant do for you? That's a really important concept to get across. And almost every one of our customers comes up with different scenarios that have nothing to do with each other, because that's what's going to help them. It's their virtual assistant. It's not about what this whole system is or how AI can do all these things. It's what do you as the human need to do better in your job. And that's just freeing up so people can focus on patient care. AI is one of those things that just is another way to help the healthcare worker do their job.
And I think oftentimes what's overlooked in the healthcare industry isn't just the fact that AI is a tool that can help healthcare workers do their job. It's a tool that can help healthcare organizations deal better with some of the staffing shortages that they're seeing. And
Yeah.
by leveraging the AI, you can actually leverage it to help you, you know, kind of close the gap on some of
Mhm.
those vacancies that you're not able to hire into. So when you're thinking through that frontline staff and you're
Mhm.
working with them on automation and looking at them with support and change, how do you help them understand that you're not a threat? Because we hear that all the time that the AI, the bots, robots are going to take over healthcare. All of a sudden, we're not going to have any human beings, and human beings are what makes healthcare work. How do you see them that what you're doing is not a threat and help them work through that?
Yeah, I go back to the concept of virtual assistant. When you sit down with anybody in healthcare, whether it's clinician, physician assistant, nurse, we've done a ton of workflows for nurses, and they have so much on their plate. And you say to a nurse, "Hey, if you had a virtual assistant, what would it do?" You'll get about 22,000 ideas from that nurse. I've been there, and those frontline workers are great, and they're doing so much. And we see so many great ideas of how they can improve. Those are the ones that know where AI can be used. It's not from a top down. It's not from IT. It's really from the frontline workers saying, "Hey," and at home they're and other features they're using AI already. This is back to the days when the cell phone was first created, and companies and hospitals said you can't bring your cell phone to work, right? Now we rely upon everybody bringing their own device, and it's bringing whatever AI will help you in your job.
And I think the price point of that AI makes a big difference too,
It
Ted.
does.
Touched upon that. One of the things with healthcare workers is the turnover costs a lot of money. So if you lose a frontline worker, the replacement cost is $50,000. It could be $75,000. I've heard numbers as high as $150,000. So if you think about the cost of a bot, right? and you mentioned it could be 7,500, it could be $10,000. You technically could put in a personalized frontline worker virtual assistant bot for every single healthcare worker, help to retain them, reduce the amount of time it's taken them to see patients, possibly even allow them to see a, maybe a little bit different nurse to patient ratio because of that virtual assistant, have better personalized care and better outcomes. And now the entire story shifts. And sometimes I think we miss that component of it in healthcare. And so let's talk about the future. Where do you see things going in the future, either with personalized solutions for frontline staff, predictive analytics, different bots? What do you see happening either through your company or just in the field in general?
You know, uh, there's just so many potential things with this technology, and I guess where the thing is, we have to get over the fear of this change. Like we had when .coms came on, there was a fear of that. So leveraging AI, and there's two components I talk about a lot with an AI. One is robotic, and one is agentic. And there are different components. A robot, you tell them exactly what you want it to do. Agentic, you give them a little more flexibility, still reporting to a human, of course. But we've been so humans tied to our computers for so long. Let's really free our human healthcare workers up to actually work with the patients more, deal with the honest problems. So really, I do see in the next 5 years this change of evolution of not sitting behind a desk, not looking at a computer in a nursing station or on an OR floor, but being the ability to work with the patients directly and with the AI components being your assistant.
That's an amazing picture that you're painting. I know, thinking about my own personal healthcare journeys and, doctor's appointments, there have been appointments where literally my doctor is sitting staring at a wall and the computer in front of them and maybe makes eye contact for 30 seconds out of the 15 or, 10-minute appointment. So there
Yes.
would be a world where all of a sudden we would be patient facing again. It could be remarkable. It would be remarkable and make a big difference.
When think about the patient interaction, I know one doctor gave this example, which was awesome example. It was like, I'm sitting there talking to the patient, I'm looking at the computer, I'm filling in the notes, and then I've got to ask them about how much alcohol they're using, right? They're not going to give you the right answer. The patient's going to lie, right? So those are sort of interactions that you have to have that personal connection, that 15, 20-minute visit between the doctor and the patient. So that's just one example. As you know, there are a lot of examples in that. We've got too much on the technology side. We need to free everybody up to focus on the patient side.
Yeah, I'll just share a personal story there because you talked about the alcohol, and you're absolutely correct that patients rarely will answer those questions correctly. My mom, bless her heart, she's passed now, but I'd go to the doctor's appointments where the doctor would say, "Well, Andrea, how much do you drink?" And how many drinks do you have? And she would say, "Many." And then he would ask,
Okay.
"Well, can you clarify that?" And she would say, "Many, many, many." And like, okay. So there's never a direct answer there. So, with that future, Ted, you talk also, and you've worked a lot with some of the 3D visualization that's coming to the market now, especially as it relates to CTs and the diagnostics. How is that technology really going to transform and completely change the way we trust the results, of our diagnosis and we communicate with patients?
And this is one I'm so passionate about. We've created a separate product called DICOM Director for this, and it's been out there helping surgeons for about 5 to 6 years now. And what we see is the common thing. And when you look at a CT or MRI, have you ever seen a CT or MRI of you? Have ever
I
shown
have
you a
not
CT or
seen one of
MRI?
me, but I have seen them of other people,
And
examples.
did
Yeah.
you understand them?
At a very surface level.
I can, and I've been at the med schools before, and they spend years training doctors to understand CT and MRI, and it's really amazing. It's like these are two-dimensional scans and slices. Now we have a way of 3D visualization with AI and extended reality allowing the doctors to explain they're going to cut out of you, explain and actually do their pre-surgical planning. We do have doctors even using that in surgery and surgical theaters. So when you look at the computing capability of AI and taking all this data that is a CTMRI and making it so we can understand it as patients, that's really powerful. And it's really coming along. It's been a long road bringing that technology forward, but it's really come along.
Yeah, and if you think through that and the ability to take those single slices and
Mhm.
now all of a sudden turn it into a 3D diagram, not only does it help to communicate it, but the precision that the doctors have, the surgeons have of what they're actually going to do prior to the surgery is just so much more accurate. And the outcomes are just going to be tremendously better.
Absolutely. And we are three-dimensional human beings, right? We're three-dimensional.
We
And
are.
someone would argue 4D over time, you know? So we're running, right? And when you look at what we're looking at on a 2D CTMRI, it just doesn't make sense. The doctors have to put that together in their brain. Well, that's what we have AI and computers for, right? To, again, virtual assistant to the doctor on that use case is awesome. And using AI and that extended reality gives us the 3D visualization part to it.
Yeah, it really does. Ted, I want to pivot a little bit to some of your broader experiences because you have the 3D visualization now that we just talked about, all the AI that you're currently doing in your role, but over your career, you've had a wide variety of experience across all the different companies you've worked with. And I think a lot of those lessons can probably apply to the healthcare environment that we're all living through right now, especially with the change and the problems that we're dealing. What have you learned from all those experiences that you could share to really help the C-suite leaders and others understand that right now there are certain things you need to do as a leader, and what should they be focusing on as they're looking at solving the right problems in healthcare? What's the first thing?
Yeah, I think the first thing would be think big but start small. Get that. It's a constant thing we've learned at Spherogen is we can't change the world until the world understands the steps to make the change, right? So we look at things we've accomplished and then we all boil them down to people working with people to leverage technology to make a positive change. And that really, from a leadership perspective, is very critical of starting thinking big, thinking, okay, I can change this workflow or I can actually implement this piece of technology, but really asking the people in the process. Back to the question I constantly ask is, if you had a virtual assistant, what would it do, right? And when you start doing that in healthcare, you really see the potential for savings, for much many ways where we can be more effective with what we're doing with the current teams that we have. Everybody's got staff shortages in healthcare. Everyone has needs. How do you free up people to do more with the same amount of people?
It's so powerful, and just pivoting the way you're looking at the problem can make such a huge impact. Oftentimes we're trained to see the lack, we're trained to see the deficit, we're trained to see the negative, but if you can see the positive of the application of the technology, the positive, the application of the AI, you can completely shift how you're looking at it and open your vision to seeing a completely different future. Now, I want to wrap up with just a few final things, and I love doing rapid fire at the end. What's one word that you think is going to really describe the future of healthcare?
I think it's really potential. It's potential for change and to change how we're interacting with patients and our interactions with people in the healthcare system.
I would agree. Future of healthcare in 2030, I think, is completely different than what we're looking at in 2025. What's the first workflow every single hospital should automate?
Again, that depends on the hospital, right? It depends on what their issues are at a time. I'll give you one example. One of our hospitals had a problem with inpatient outpatient flow, right? And it just took so long to recode the claim between inpatient and outpatient, right? And that was the first one they chose. Not what I ever think about, but they had a problem where they couldn't discharge patients because they didn't have the language they needed in the discharge instructions. Wow, that's a great use for AI, right? These are the simple things, and everyone is different. I'm really adamant about looking at how you use AI in your organization is how you use AI in your organization. Work with your people, ask them what would help them. There's no like magic bullet of here's the 200 AI bots I'm putting in today and it's going to solve my problems. Not going to happen. You still have the people have to lead the change.
Yeah, I think that the best way to summarize that from a productivity perspective is we often, hear is this apples to apples? And we often say that, well, if you've seen one hospital, you've seen one hospital. And I
Yes.
don't know if you know this, but there are like 5,000 different types and varieties of apples, and there
Yeah,
are just as many different varieties of hospitals. And I think you answered that appropriately, that your solution for AI is going to be a little bit different than someone else's best case scenario. What do you
absolutely.
think is the biggest myth that exists in the industry about AI?
That'll take jobs. I think that's a myth that we have seen a lot, and we have seen where hospitals are just doing the kind of budget cuts. They're not filling existing staff roles, right? So we have seen AI where you're going to actually you had an open position, you're going to have AI do that open position. We have legitimately seen that. So I understand where the concern is coming from, but AI itself can't do these jobs. It has to be human control. It's got to be humans that drive it.
Along those lines, if you're implementing AI and you're putting something in place, what's the one thing that, a CEO, a CFO, a CIO should track when they're putting the tool in
The
place?
CFO is always going to look at the ROI, right? They show it from the CFO perspective. From a CEO perspective, I think it's different because you really want to look at how the AI can help implement change and implement faster service to the patients, right? We've seen so many of our customers that are looking at, oh, well, we can use AI to do this versus that, right? And you have some interesting conversations between CEOs, CIOs, and CFOs. And the chief medical officers come in a very strong opinion many times. Hey, I want AI for my clinical use cases, right? Because that's the biggest bang for getting the usage, getting the people freed up to work with patients. So it really is a balancing act across the organization of where you use AI and where you start with AI. Don't wait for your EHR vendor to do everything for you, right? I,
Oh,
I've seen that a lot of times, and again, the EHRs are doing a great job on implementing AI. There's a cost to them, there's a cost to everything, of course, but there's the opportunity cost of not doing it now.
if you were not running the company right now and you didn't own SphereGen and you weren't making such a big difference in the healthcare world, what would you be doing?
I enjoy what I'm doing right now, and one of the things that we're doing is creating products as well in healthcare. We have a product for reading analysis, which I'm very passionate about. That helps us. We developed with Yale Neurooptometry, helps us analyze a child's reading issues. Right. Obviously, being an entrepreneur running many companies, I've had ADHD my entire life, but it wasn't diagnosed till mid 40s. Right. And I think tools like this that we're leveraging with AI and in this case extended reality are my passion, right? So if I wasn't doing that, I would be working on these other projects because I think they're fascinating what we can bring to healthcare to help. There's a lot of tools that we've never been thought about yet, that have not been invented yet, that are out there that have the potential.
What book, podcast, learning opportunity would you share with the listeners? If there's something they should listen to, watch, read, participate in right now, what would it be?
Hmm. I would say participate in the organizations like HFMA. I'm a big. I learned so much sitting with revenue cycle managers, sitting with CFOs, and understanding their problems. And I think that's you can read and learn it from a high level on podcasts like this one, which is great. But sitting down with those people and understanding their problems, what their challenges are, we had over the HFMA event in Syracuse, one of the people sitting on the round table said, I'm having this problem with bank reconciliation. because I have 3 different banks and they were a community hospital. And I'm like, oh, I know somebody that's done that. Here, let me pick up the phone. I texted my friend and he said, yeah, here's how you do it, yada, yada, yada. And solving those kinds of problems is a personal connection. If I wasn't sitting at the table, she wouldn't have that answer. I mean, she was struggling with that.
Hmm.
And her IT people were trying to help her. But really, these are simple things. If we have to go out and make those connections, I spend a lot of time on the road, as you do, but I really enjoy making those connections with people. I think we learn so much from each other on those roundtables.
Yeah, there's so much value in being in person and participating in those professional organizations and actually interacting and hearing the problems so you can provide solutions.
Yeah, I did a 6 hospital tour in Washington State and Oregon a couple weeks ago, and it was over 1,200 miles to go to different hospitals. And it was fabulous because I got time to go to their hospital. We don't often have that time, but I think I've learned more in those visits to the hospitals and the HFMA type events than I do from anything else I do. And I do read a lot. I'm a big reader, but I just enjoy those in person meetings. I think a tremendous value in that.
So, Ted, thank you so much for being here today. We've touched upon so many different areas. One of the things that's really reverberating in my mind right now is that your AI technologies and bots and what SpiritGen's doing and other companies is that you're not replacing people. You're actually freeing the healthcare workers to do their jobs better at having more time to take care of the patients. Where should people go to look and find you?
We have our learning center on sphergen.com, which has been great as we've done interviews and you can see bots running, you can see agentic AI doing stuff, and you can hear stories from CFOs and CEOs about how it works. So our learning center on sphergen.com.
Everything we talked about today is really what Beyond the Benchmarks is about. Productivity, it's not about squeezing more out of your people. It's about removing the roadblocks that they're focusing and facing. And that's exactly what SphereGen and some AI tools can do. That's what matters most. It's the automation done right, gives people time back, gives them their purpose back. So I thank you for your time today, and I thank everyone for listening today. Ted, thank you. It's been a pleasure. And everyone
Thanks,
else,
Stephanie.
thank you. And until next time, I'm Stephanie Dorwart, and I look forward to seeing you on the next episode of Beyond the Benchmarks.